Hi, my name is AJ. I'm going to be your nurse today. I'm here to do your tracheostomy care and suctioning. Is that okay with you? Yeah? All right, sounds good. I'm going to go do hand hygiene and provide privacy. And then can you please confirm for me with a thumbs up or a thumbs down your name, birthday, and your allergies? Is your name Rose Valentine? Thumbs up? Yes, okay. And is your birthday January 12th, 1990? Thumbs up? Yes. And then you are allergic to penicillin and bananas, correct? Thumbs up? All right, sounds good. I'm just comparing my MAR to the patient's band that we have here. Okay, and everything matches. So at this time, I'm going to assess vital signs alongside with the ABCs. So I'm going to, is it okay if I listen to your lung sounds? Thumbs up? All right, sounds good. So I'm going to check here. All right, excellent. From what I heard, there's adventitious lung sounds as well as like a little bit of congestion. So, and after doing the vital signs, we can also see that the breathing is normal. So the airway has a little bit of congestion, the breathing is normal, and the capillary refill is under 3 seconds as well too. All right, at this point, I'm going to hyperoxygenate my patient if they needed it in case they were a little bit low since we're doing suctioning. Okay, and then I'm going to check my suction. All right, suction is working well. At this point, I'm going to set up my sterile field. So let me set this up first. I'm going to be placing this bag right next to your leg. Is that okay? Thumbs up? Good. Just try not to kick it off, all right? Okay, very good. All right, then now I will be setting up my sterile field. Okay, very good. I would do some hand hygiene. Okay. I'll dump out my items. Excellent. That out. Our cannula. Our catheter. Excellent. And then I would fill this up, the 2 sides, with saline on 2 sides. And then now I'll place on my sterile gloves. Now we're fully sterile. We're going to take our cannula, I'm sorry, not cannula, our catheter. Okay, and now this is going to be our dirty hand. So we're going to remove our oxygenation. We're going to attach our 2 pieces here. And this is when I would turn on the suction. Okay. The first thing I'm going to do is check to make sure that the suction is working. All right, excellent, I can feel it. So now we're going to perform our suctioning. I'm not gonna apply suction until we've inserted the catheter, and we're gonna insert the catheter until we feel resistance or until the patient coughs. All right, and once we get to that point, then we're gonna apply intermittent suctioning in a circular motion at the same time while removing the catheter. And we don't do this longer than 10 seconds. And then I would ask my patient if they needed more suctioning. He gave me a thumbs down, no. Okay, that's great. If my patient needed more suctioning, I would wait 30 seconds in between and not do it more than 2 times, no more than 2 times in order per catheter. And then at this point, my patient doesn't need any more, so we're gonna discard catheter. Perfect. Place this over here. We would turn off the suction. It's okay, leave that there. Okay. Now we would remove this cannula and with our sterile hand, place the new one. Perfect. And now we can break sterile. So I'm going to remove the old dressing. And then we're going to use one of the gauze here with the saline and to clean around the stoma. And then in the hard to reach places, we can use a Q-tip with saline to clean if we have to. And then I'm going to dry the area, make sure. And then we'll place the new dressing. Okay, and then at this time, I would go ahead and reassess my patient. May I listen to your lungs again? Thumbs up? All right, good. Okay. All right, based on what I heard, your airways are now clear. And at this point, I would clean up all my items, lower the bed, keep the side rails up, perform hand hygiene, and make sure that they have their call light.